Welcome, welcome everybody. Um, my name's Ashley Shaw, and I'm the medical director here in Cambridge. We're now live on Facebook, so we'll get going. So for everybody on Facebook and Zoom, welcome. My name's Ashley Shaw, and as I've said, I'm the medical director here in Cambridge, and I'm pleased to be joined today by Sunil Dabasia, who's the Deputy Chief Pharmacist here at Addenbrooke's, and Giles Wright, who is the Associate Director of Operations, who has responsibility for occupational health and the vaccine programs that we run here at Addenbrooke's. So first of all, I'd like to welcome you all to this webinar today. The first thing I'd like to say is you'll all be aware that since the start of the pandemic, huge numbers of people have been working around the world to develop a vaccine to try and stop the spread of the virus. And many of you out there in the organisation may have been involved in that, or will have participated in some of the national trials, or contributed in some other way. And we've all felt the impact of the pandemic. This has been one of the most challenging years in NHS history. And I think it's time, I think you will have seen the news regarding the vaccines, which are starting to emerge. And many of you will have seen those in the newspapers and in the BBC, the ITV and other things. And so I just thought we'd just have a general chat today, broadly about vaccines, and then specifically a little bit about where we're up to with COVID vaccines. So there are a number of COVID vaccines that appear to be progressing well, and which appear to have been submitted. They've now submitted their data to the Medicines Healthcare Regulatory Agency. So that's the MHRA. And that's the standard process. And as you all know, we will be expecting to move forward and wait to hear from them in the first few days of December, hopefully. And that's the current expectation. But I think probably the first thing I wanted to talk to you about was broadly how vaccines work, and to try and debunk a few myths, really. I think that's really the most important thing. So one analogy I wanted to talk through was when we see a vaccine to a virus, that's not the virus itself that we're injecting into you. In effect, what we're doing is this is something taken from the virus, a little piece of the virus that's being replicated. In another way of thinking about it, this is almost like we're taking a mugshot of the virus and we're showing it to your immune system. Okay, so that when your immune system sees this virus again, it can recognize it. It can recognize that this is not something that your immune system wants, that this is something that can make you ill, and therefore it's able to respond much more quickly in the same way that you would if the police saw that mugshot out there in the community. So now we know what it looks like. Your immune system is able to respond more quickly, and the aim of the vaccine is to help your immune system be ready for when it encounters the virus in the future. There is no way that you can become ill with the virus through an injection of a vaccine. There is, in the same way that a mugshot can't steal from you, the vaccine will not make you ill from the virus itself. And I think that's probably the single most important thing to know. The second most important thing is that obviously when these vaccines come out, they will have been tested. They will have been tested extensively, and the Medicines Healthcare Regulatory Agency will have evaluated all that safety data, and it will be published. It's not yet published, and that's why we can't tell you everything about it, but it will have been published and it will be available to us before we start giving the vaccine. Those are two of the key things that I wanted to talk about. And the third thing is, as with every vaccine, there can be sort of short-term temporary side effects, and I'm sure Giles will, or Sunil will pick up some of those. But again, those are short-term, short-lived, and as far as we can tell so far, we're not seeing any serious side effects. So we'll wait and see how that comes forward over the next few days with the MHRA. When we do have the vaccine available, and hopefully that will be very shortly, what we would be doing is running a program of vaccination across the trust. And the aim and our request of you is that you come forward and participate in the vaccine program. So the vaccines will be protective as a whole. If they're agreed by the MHRA, they'll be protective as a whole. And on the whole, the view will be it would be better for you to have the vaccine than not to have the vaccine, and these will be protective to a greater degree than 50-50. That's the general rule of being a vaccine that's accredited. So important to remember that if you're vaccinated, the aim would be to reduce people becoming ill with COVID. The aim will be to reduce you being able to pass it on, and the aim will be to reduce the chance of you catching it. So all of those things will contribute to us getting through this pandemic process. So from where we are now, we don't have all the data, but what we will do is to try and talk you through what we do know so far, and to be very clear where we don't know what data is available yet, and to share that with you over the coming minutes. So first of all, I'm going to hand over to Giles. So Giles, over to you.
Thanks, Ashley. Good afternoon, everybody. So as Ashley's suggested, we've been preparing for the rollout of this program extensively. So we've had a lot of people, a lot of resources going into mobilising to be ready as soon as the vaccine's made available to us and it's approved, and that we have everything in place that we require for a safe rollout. We are good to start. So just talk you through a few of those details, but before I do, a massive thank you from me to a number of teams, and apologies if I miss anybody out. It's not an intentional, particularly occupational health colleagues, estates, procurement, pharmacy, IT, and the Workforce Directorate. And there will be many others that have been busying away in the background to make the programme happen. So just a big personal thank you to each of you and your teams. So our plan is to run clinics in the Deakin Centre. There are logistical challenges with this vaccine. So we've looked at where we can do this in the safest way and in the pace and maintaining social distance that we obviously must adhere to. And the most accessible place that we can manage all of those things, all those factors. So the Deakin Centre will be our super clinic, really, and the plan for that will be 7 days a week, so as accessible as we can make it, and it will be from at least 7 in the morning till 6 in the evening, and we are looking at the feasibility of making it an even later finish, 7 days a week, but to start with, it will be 7 in the morning to at least 6 in the evening, 7 days a week. We will be vaccinating CUH staff. We're also expecting to vaccinate other healthcare workers from local organisations. In order to safely manage the number of people attending clinics, we will be asking people to pre-book. That will be an essential element. So slightly different to our flu clinics where it's a drop-in. We will share the links on the staff portal and all the other information relating to the vaccine as soon as we're able to do that and as soon as it's all available. And we will, of course, give you the important joining instructions at that point as well. Just to reiterate a couple other brief points, if I may, Ashley, then. So bookings will be on a first come, first served basis. We are looking at the moment at the eligibility list. So the Green Book has been published in draft, which suggests which staff groups will be coming in priority order, but that is still in draft form. So as soon as we've got that finalised, we will make you aware of the order of staff and what order you're to come forward in. You will be asked a number of qualifying questions, and that's really part of the safety checks. And also, as I say, this is going to be a programme available to not just CUH staff. So we just need to run through those qualifying questions online when you're booking. Please ensure you complete those as required. We will also be strict, I'm afraid, but we will be asking you to bring your ID badge, your employee ID badge with you to the appointment that you choose. And nobody will be admitted without that, as I'm sure you can appreciate the needs for that. And there will be no exceptions, I'm afraid. And I know that all CUH staff will be kind and understanding in that. Actually, I'm going to pause at that point, but I'm happy to pick up any questions. You're just on mute, Ashley.
It's traditional for someone to be on mute. Shall we pass over to Sunil first, and then we'll go through some questions? We already have some questions in, and then we'll be able to take things, take the questions both from the chat and from those that have been sent in advance. So Sunil.
Great. Hello, everyone. Thanks, Ashley. So just to add, pharmacy is doing a lot of work in the background just to make sure that we're ready, we're prepared, so that once the MHRA does approve a vaccine, we are able to receive that straight away and have that available to the deacon. We are aware that there's a huge operation underway to support this, and pharmacy will also be present at the deacon to support with this. And as soon as we have more information, we're able to help with providing that information to everyone.
Okay, thanks, Sunil. Okay, so I was going to say, I'll go through I've got a few questions that have already been sent in advance, and I'll go through those. And then if we pick up the ones that are on the chat and the Q&A session. So the first thing is about which patient groups are able to receive the vaccine. So I think we'll take that, and maybe if, so first of all, I've got a question. Can you have the vaccine if you are pregnant? And if, Giles, do you want to take that one?
So the Green Book, so this is the Bible on vaccinations that we follow in occupational health, as do many other teams. It is saying that in draft form, still to be confirmed, but it's saying in the draft form that if you're pregnant, you're not to come forward for the vaccine. As soon as you have completed your pregnancy, then of course you absolutely should get vaccinated, but not during pregnancy, is what we're understanding at the moment.
Thanks, Giles. We have a question. Would you offer the vaccine to breastfeeding mothers?
So Sunil can correct me if I'm wrong, but my understanding at the moment is yes. It looks like that's allowed, as it were, permitted. But again, that's in draft materials. But Sunil, is that correct?
So we haven't seen the actual specific information leaflet on the medicine, but that will be confirmed on there once we receive it.
Okay. And on a related matter, can you have the vaccine if you are trying for a baby?
I've not seen anything on the leaflet as yet, but we still need to see that leaflet to confirm. So that's something we don't know still.
Okay.
Yeah, I was going to say the same.
Yeah.
That's not something we've seen in other vaccines. That's been a contraindication as far as I'm aware, is it? But we need to wait. We need to await the fuller data for that. Would that be a fair assessment?
Yeah.
Okay. So the next one is, can people who have tested positive for antibodies still receive the vaccine? I'm going to take this one. I think my understanding as it currently stands is there is no plan to test patients to see whether or not test staff to see whether or not they are COVID positive. And my understanding is at present, everyone would be invited, everyone who's within the group will be invited whether or not they've previously tested positive for COVID. The only group that would be excluded from a recurrent vaccine or who would not need to have the vaccine specifically would be those who've already participated in another vaccine trial and who were given the active vaccine. So if you've been, for example, part of the Oxford trial that we ran here and you've had the 2 doses, my understanding is that we'll get further information in the near future, but that you wouldn't need to then come forward for another vaccine if you've already received one. But you will do that. So if you have tested positive for antibodies, you would still be expected to come forward for the vaccine. As I say, I take these again. So the immunosuppressed or those taking immunosuppression drugs. Sunil or Giles, either of you?
So again, some of the information is limited, but it's about whether or not you have a full immune response. So we're still awaiting information on whether or not that is going to be valid.
Yeah. I think, apologies, we don't obviously have all the data because it hasn't all been published yet. And I think the important thing is we let you know what we do know, and important to let you know what we don't know very clearly. But all of these should be clarified over the coming days, I think, by the MHRA. And we'll be able to add to it. I think a similar request about whether if you're HIV positive, I think that would be related. We would be expecting for further guidance on that from the national team. Do we know yet whether the vaccine will prevent transmission? Again.
So I think the data so far has been limited on that, Ashley. I don't think that's been entirely evaluated, is my understanding.
My understanding is that the primary aim of the studies has been to establish whether or not the individual became COVID positive, not to determine whether or not the patients had reduced transmission onwards. The data that is in the public domain seems to suggest that there is a reduced incidence of COVID in those patients who have had the COVID vaccine compared to those who've had the dummy vaccines, but I don't think they've been able to evaluate onward transmission. Okay, sorry, I'm trying to work through from 3 different sources of questions here, so apologies for my things. If we move on to staff groups, the first question is, will the vaccine be mandatory for staff?
No.
No, quite. I think we'd strongly encouraging the vaccine, but we would. It's certainly not going to be mandatory. Then there are a couple of questions on the number of doses that will be required and how we will do that, Giles.
Yeah, so it's a 2-dose vaccine. So there will be a block of clinics for the first dose, most likely 3 weeks worth of clinics with plenty of capacity every day. As I said earlier, first come, first served. Then there'll be a brief pause in the campaign, and then the second phase will open for your second dose. There will be an overlap. So if somebody for unplanned reasons is not able to get their first dose in phase 1, they'll be able to have it early in phase 2, and we'll extend phase 2 to allow you time to get your second dose, if that hopefully makes sense. But we'll certainly be asking everyone to come forward as soon as possible. There will be between a 21 and 28 day period between your first dose and your second dose, and that's to be confirmed. It looks likely to be 28 days, but that's to be finalised. Okay, and will the teams, as just to reiterate, the teams, all of the clinical, once we've identified those staff members and clinical students that are eligible for the vaccination, Giles, once we've identified the general priority of that, and that's a national determination. Once those have been determined, the aim will be to open up the vaccination program to all of those in the both who work for CUH and who work for the other organisations. So is it just worth explaining why we are going to be offering, why we are going to be doing the vaccinations to other organisations briefly, rather than
just CUH staff?
Yeah, of course. So the actual vaccine has logistical issues, as Giles has mentioned, and actually one of the challenges is transporting the vaccine safely. And because of that, one of the requirements will be for us to try and vaccinate as many staff at the CUH site as possible.
Okay, good. And there's a question here. Do you get proof that you've been vaccinated?
Yes, so the once you've received the vaccine in the clinic, you'll be given a vaccination card, which will contain some details. It will also indicate the first day you could have your second dose. You'll also be given a GP letter for you to either retain for your records or ideally pass on to your GP. We'll be asking you to do that.
Okay, good. Thank you, Giles. And can I just confirm, clinical medical students and nursing students and AHP students, for example?
Absolutely, yeah.
Okay.
All in scope.
And again, we've got a question here. We said it's not mandatory. It might be worth just reiterating the trust position here on those members of staff who choose not to have the COVID vaccine. I'm happy to take that. So we would strongly encourage you to have the vaccine once it's been approved as safe and effective by the MHRA. We understand that there will be people who choose not to, but I think we would ask you to consider strongly the benefits both to your own health, to those of your family, to those of your patients, and to those in the wider community. I think overall the benefits will be positive, and this will enable all of us to get back to what we might term the old normal rather than the new normal, which many of us would absolutely love to do. So I think but this isn't a matter of the trust taking disciplinary action in any way, shape, or form. This is us trying to keep you, our staff, our colleagues, our friends, as safe as possible, and as keeping our patients as safe as possible, and to keep your families as safe as possible. And so this is a positive offer, not something that is in any way, shape, or form would form any sort of disciplinary or negative connotations. So I think I just want to be absolutely clear on that. There is a question about the period of time needed between receiving a flu vaccine and a COVID vaccine, Giles. I don't know if you want to take that.
Yeah, so it's 7 days. So you shouldn't have the COVID dose one within 7 days of your flu vaccine.
Okay, and we've at CUH we've stopped the current flu vaccination program in order to be able to facilitate that 7-day gap.
That's right. Yep.
Okay. There's a question here about medical students who are on placements elsewhere. And my understanding is that the medical students, as we're offering the vaccine, and we'll be giving the vaccine to people who are working at different hospitals anyway, it would probably be available. This will be available to all clinical students who are working at those hospitals. Would that be correct, Giles?
That's right, Ashley. Yeah. So national criteria is absolutely clinical students will be in scope. It will just be a question of which is the nearest hub for them to get to in the best way. Yeah. Okay.
There are a number of questions about which vaccine we will be offering. I don't know, Sunil, do you want to?
Yeah, I mean, unfortunately, because we haven't got a vaccine approved, we're unable to confirm which one. But as soon as one is approved by the MHRA, that's when we'll be able to share that information with teams.
Thanks. And will we have a choice of vaccine, do you think, Sunil?
It all depends on the distribution and the allocation as well. So again, it is all dependent on timeframes for approval. But again, more information awaiting.
Okay. And I guess the key thing is, there was just a question. So do we know so far what side effects have been reported?
Do I take that one? Do you want to, and
Please.
Sunil add in? So we know that a painful arm or tender arm is a common side effect. It would appear in the first dose, less likely in the second dose. We know that you might experience a headache or perhaps some fatigue, all of which respond well to normal paracetamol, oral paracetamol. For some in the under 55 age group, you will have an elevated temperature, but again, responds well to paracetamol, doesn't last longer than 48 hours at the most. So that looks like the data so far. But Sunil, have I missed anything?
No, that's everything to add. Yeah, absolutely.
Okay. Brilliant. I'm seeing a number of questions come through. The question about the other vaccines. So is flu? So we have other vaccines other than flu, which people are receiving. Should there be a 7-day gap between other vaccines and COVID?
Yeah, there should be, and that's mainly just so we can be really clear on any reactions that we get being able to be attributed to one particular vaccine. So that's more about safety really, rather than contraindications. So what we're doing at CUH is we're pausing our routine occupational vaccines for a small amount of time as possible whilst the campaign's going, unless of course you require them because you've had an exposure or there's another clinical reason why we feel we should override that on a one-to-one basis. But in general terms, we're pausing them actually to allow for the COVID vaccine rollout.
Okay. And if you have had the vaccine, does that mean, what does that mean? What will that mean for isolation, Giles? Do we know that yet?
Yep. So for the 48 hours after, like I say, you may experience an elevated temperature, which is of course a COVID symptom in itself. What the guidance looks like being confirmed as, if that is the only symptom and it is within the 48 hours post your vaccine, you do not have to isolate. You can continue. However, if other indications suggest it could be COVID, then of course you must isolate, you must contact occupational health and we will test you. So just to be clear, if it's purely a fever or an elevated temperature and it's post-vaccine 48 hours, you do not. But if there's other indication or if in doubt, you must and contact OH.
But we don't yet know if you've been vaccinated and then you're a contact, or we don't yet have the national detail as to what that will mean for you in terms of isolation, test and trace, etc. We don't have that detail yet, and that's waiting to come out.
That's right. Yeah.
Okay. I'm just seeing a few more questions. So the second vaccination dose, that will be scheduled in the same way as the first. Is that correct?
Yeah, so we'll give you the vaccination card, which we're going to ask you to look after and guard with your life, because that will be an easy way for you to know when you're due your second dose. And then, yes, we'll ask you to go back online again and book the appointment to fit with your schedules and diaries, providing it's after that initial period.
Okay. And if you're on an honorary contract, but actually employed by Cambridge University, again, you're eligible for thing if you're patient facing, yes. I think the key question is, when do we think that we might see the rollout, Giles? What's the current position?
So we're waiting confirmation from NHS England on that, and obviously it's all down to MHRA approval as well, of course. However, we're finalising. We're nearing the end of our finalisation of being ready in terms of mobilisation and logistics prep. So we'd anticipate within a few days of getting the green light, would be good to start clinics.
Yeah, I think just to add to that, we've done a lot to make sure that we are in a position to be ready, so that once it is approved, we can move straight ahead with it. Yeah. Okay.
The questions are flooding in. You'll be pleased to hear, guys. If people are allergic to paracetamol, again, could they take ibuprofen? I don't think we've got that data yet, have we?
No.
No. We know that. So, and do we know yet how long after the second vaccine are people thought to be immune? I think, if I could take this, my understanding is that none of the vaccines, and no vaccine ever, gives 100% immunity. So we'll need to wait for a significant number of people to have been vaccinated before we can start to change. It's likely to see national policies change dramatically. And so one should never assume that one is 100% immune, and indeed we'll be carrying on with the asymptomatic swabbing program at CUH. But it is thought generally that it would require, if you were to become immune, then it would be at least a couple of weeks after the second dose of the vaccination. Would that be where? That's my understanding from the data so far. Yeah. Okay. So there are a couple more. So non-patient facing staff, we're still awaiting guidance. Giles, do you want to reiterate that?
Yeah, that's right. So this is a national level decision on the rollout, which we have to follow. But yes, we're awaiting confirmation on that. Of course, we want to give this and be able to give this to as many staff as we're permitted to. Okay.
And there's a question of what if you're available for the clinic? What if you're not available for clinics that are running in the 3 weeks? For example, someone is working away.
So there will be a slight overlap into the second phase. So I'd hope between those two, sums would be able to reach you.
Yeah. Okay. If you've already tested positive, I don't think there's any time interval. As long as you're feeling well, my understanding is there's no time interval as yet, but we'll wait for further confirmation before you can have the vaccine. Is that your understanding? We're waiting final confirmation, but as long as you're feeling well and have recovered from COVID.
Yeah, I think there is some suggested period of time if you're asymptomatic and tested positive, but again, we'll confirm, Ashley. Yeah.
Okay. And also a question of how long will immunity last? I think obviously the vaccines have only been deployed for a number of months. So I don't think we're able to determine how long the vaccines will last, and that will be awaiting further trials and national guidance as to whether we know. We don't yet know whether or not further vaccinations will be needed in the future. I think that would be unhelpful to sort of to guess at that level. Would staff who have missed the flu jab because they were working from home be offered the flu jab on returning to work, Giles?
So we've paused the flu campaign currently. We may be able to reopen it for a brief period after the COVID vaccine, but it's all to be determined by the schedules. Essentially, it's unfortunate that you've missed it, and I'm sorry that you have. It is still available in the community, particularly within pharmacies. So I'd encourage you to get down there today if you're able to. You've still got a window of opportunity.
Okay. And the other question about there's another question about asymptomatic swabs. Yes, I'll repeat that. Yes, please, we are going to be continuing the asymptomatic swab process. So no, there's a question about, do we know what is in the vaccine yet? I think you may struggle to answer that one, but I'll leave it over to you.
Sure. So we are awaiting the information on the individual vaccines and all their excipients. As soon as the vaccine is approved, we will get the detail that we can share and have it published as well. But at the moment, we're unable to confirm the exact excipients.
Okay, thank you. And in the same way, contraindications and allergies, we will await that detail from the MHRA?
Both are related. Yeah.
Yeah, there'll be a healthcare leaflet.
Yeah. And then there's a question about if everyone in the workplace is vaccinated, would we all still need to wear masks? And I'm happy to take that one. So obviously, a vaccination, as I've said before, will only have will not be 100% effective in every single individual. No vaccine ever is, and so therefore we will await national guidance from Public Health England. But it is likely that in the first instance we will all continue to wear masks and take should all continue to wear masks, visors, and PPE exactly as you would before, until Public Health England and the national bodies advise differently. It is likely that we will need significant numbers of the population, and we would need significant reduction in the incidence within the community before we're able to advise that with any confidence. But we will await that coming from our national teams, and that's similar for close contacts or travels. You'll still need to follow all of the national rules as and when they apply, and that's likely to take a period of months before we're able to change any of those. Do we have any detail yet, Giles, on the likelihood of the vaccine programme continuing into next year beyond our initial phase?
We don't yet. We're awaiting some guidance on the national team about that, and whether this becomes a routine pre-employment vaccine, for example, and we've talked about whether it become an annual cycle or not. We just don't have the information yet, Ashley.
Yeah, and just to confirm, it's not mandatory to have had the flu jab prior to a COVID vaccine. They're in no way linked, are they?
No.
Okay. I'm just going through. I think we've covered all of the questions that I'm able to see on here. So I think so. Oops. So in summary, I think the key things. So more have just come through. So just to confirm, the people who will be eligible for the vaccine is not yet clear to us. It will be clarified in the coming days, and it will be clarified by the national team as to who is eligible for the vaccinations in the first round. And I think that's important. And so we need to wait and see who is that. We need to wait and see from the medicines regulators which patients will be not able to take this vaccine for medical reasons, whether that's asthma, neurological conditions, or immunocompromise. We're going to have to wait and see, but as soon as we have that information, that will be shared as widely as possible. And again, whether or not the order and the tempo with which each staff group is done will be determined by the national teams, and either whether that's through the hospital, whether that's through rollout in general practices, or whether that's through mass vaccination centres. We'll need to follow the national rules on that one. Okay. There is one other question about where else in the east of England will be hubs. Giles, I don't know if you want to take that.
So it's to be confirmed by the East of England, NHS England, East of England team. But we know that we will be one, and we understand that MWAFT will be another in our patch. Okay.
Those are I think there are a number around, and they will increase over time, aren't there? But, right. But the ones that are local to us. There's a question about whether it's possible to be a carrier despite having been vaccinated, and will family members be offered the vaccine? Again, so my understanding is that there isn't data. So as I said before, despite having been vaccinated, there is no 100% vaccine that can tell you that you would not get the infection and that you could not pass it on. This is the nature of all vaccines. Staff family members, we have not yet received any indication as to as and when they would be vaccinated or included in any vaccine program, and we'd have to wait and find the information from the national team. But that will be decided by the Joint Committee of Vaccination and Immunisation, who report directly to the government. So I think those are all of the questions that we have. Okay, so in summary, we are hoping, so in summary, the vaccines that we are seeing have been developed very quickly at an unprecedented pace, but with all due regard to safety measures, and they will be considered by the MHRA over the coming days, and hopefully we'll be able to receive a decision from them in the coming days to understand when this vaccine, whether the vaccine is safe and effective. Following that, we would anticipate a rapid process that will take it from the approvals position to the distribution into staff, and we are ready and waiting for that to happen as soon as that is available to us, and we'll be delivering that to our staff over a two-dose period over the next few months, and that will be delivered at the Deakin Centre, as Giles has said, and we'll communicate the booking process as that is available over the next, hopefully over the next few days. But we will obviously not start taking bookings until we definitely know it's available. When the vaccination is authorised by the MHRA, we will then know with some certainty which patient groups and staff groups are not able to take the vaccine either for medical reasons, or which ones have been prioritised in the first instance. And again, we will share that communication as soon as we have it. We would like you to all to have that information. Is there anything else anyone else would like to raise? Sunil?
No, nothing further from me.
Giles?
Just a couple of very brief points. I knew I'd forget somebody to thank at the beginning. So just say a big thank you to the comms team, and particularly for Tony's support. And yeah, just to cover that point, Ashley, so the portal will be a sense of all place to go for all information and making sense of everything. So look at their due course. Thanks.
So the plan from here is the first of all, just to remind you that the vaccination, the benefits will be maximised the more people that we have who have received the vaccine. That's the nature of vaccines. The more of us that take this vaccine and to start to create this immune cohort within the organisation and around the wider community, the better. So I would encourage you to take up the vaccine as soon as we have it available. And the second thing to say is that as more information becomes available to us from the MHRA, from the various drugs trials, we will seek to arrange another Q&A session to be able to give you more information, to be able to answer more of your questions over the coming weeks. Okay, so thank you very much, Sunil. Thank you very much, Giles, and thank you very much to everybody for tuning in and listening to us today. Thank you very much.